Good evening, everybody. I'm Sayukta from Prostate Wellbeing Team, and I'm sure all of you must be keeping good health. Today, we are going to discuss about a very important topic that is benign prostatic hyperplasia, very commonly known as BPH. Benign prostatic hyperplasia (BPH) is the non-cancerous enlargement of the prostate, usually begin in the 50s in men, and in many men may cause obstruction to urine flow. Many men have to get up and go to the toilet at night, and it's one of the most troublesome aspects of this condition as it makes them tired during the day. Having to urinate frequently during the day, sometimes with a sense of urgency, can also be tiring for patients and can make traveling or attending events, socializing, etc., really troublesome. A doctor, such as a urologist, can treat this condition and help the patient to get relief. So, to throw more light on the subject and guide us on what's right for diagnosis and treatment of BPH, today we have with us renowned urologist Dr. Vijay Kumar, MS, DNB surgery, DNB urology. He has a rich experience and hands on expertise in stone management as well as in treating urological problems. He is currently practicing as Associate Director and Unit Head of Reconstructive Laproscopic Urology at Max Hospital, New Delhi. Dr. Vijay Kumar has rich experience in the field of urology and carries out the diagnosis and treatments with utmost precision and efficiency, ensuring that the patient's health is in safe hands. A very warm welcome to you, Dr. Vijay Kumar. It's a pleasure to have you with us, Doctor.
Yeah, good evening. Good evening. Thank you very much for making me here to speak to the public and take their queries as and when required. So we can start with the conversation.
Definitely, doctor. As we all know, prostate is a organ which is present in men, and many times we have seen that specifically after a certain age, 45 or 50 years of age, men face many problems regarding prostate. Enlargement of prostate is very common. But the problem is that people tend to ignore the symptoms, ignore the problem, and they keep on suffering in silence. So today we would like you to throw more light on that. To start with it, doctor, what is prostate? Prostate hai kya?
Yeah, prostate is actually a axillary sexual gland. It means in the man, the male sexual organ is testicle, and a gland called prostate is situated just below the bladder, and it encircles the urine passage, which we call as urethra. So if we take this as a urethra, the prostate is encircling the urethra all around and is just below the bladder. So this gland is in man is active once we reach to the puberty. So it starts making semen in us and men. And once the testes start producing sperm, these sperms are carried with the medium, liquid medium, that is semen, in ejaculate. So this helps in the sexual function and fertility aspect of the man.
Right.
So that's
And
the function of
right. And as you said that urinary tract, goes through the prostate, right? So that's the placement of prostate. And that's why probably this is the reason when enlargement of prostate happens, people do get these symptoms related to urinary functions or urine pass, etc., like frequency, urgency. We'll talk about that as well. But before that, doctor, what is BPH?
Yeah. BPH is, in technical term, if we elaborate, this is a benign enlargement of prostate. Benign means non-cancerous. Enlargement is increase in the size of prostate, and H stands for hyperplasia. That is, the number of cells are increasing in the prostate. So BPH actually means benign enlargement of prostate or benign prostatic hyperplasia. It means there is no cancerous activity in this group of patients. There's only the size which increases. And if we see the actual constituent of prostate, there are glandular cells, there are muscle cells, and there are stromal cells or the fibrous cells. So any of these can increase in number and enlarge the prostate in size.
Right. How common is enlargement of prostate, doctor? Benign enlargement of prostate. We get to hear a lot that, after a certain age or aging is one of the risk factors. And as you know, our hairs also turn gray with age, which is a very natural process. So prostate enlargement is that natural. This is what we normally hear. Is this correct, doctor?
Absolutely. This is the, in men is a aging phenomena. And usually we see after 45 to 50 years of age, when there is a little decline in the male hormone levels, there is an imbalance between the men, in men, between the male hormone and little bit of female hormone, which is also in men. There is a little imbalance. So once there is an imbalance, then the enlargement of prostate happens. And obviously, as you said, that is a aging phenomena. So we see the graying of hair. We see some patients at 60 years of age turning to have cataract, some joint problems. So all these are part of aging phenomena. And some patients may have little early enlargement of prostate, or some may have very late, maybe in 70s or so. But on an average, 45 to 50 years is the age when the change in the prostate starts happening.
Okay. And doctor, what are the symptoms of BPH?
Okay. Now, as I said that when we are talking of benign enlargement, so obviously is the size which is causing the trouble. And I explained that the urine passage is traversing through the prostate. So, चूंकि ये prostate के बीच में से जाता है urine passage. So if there is an enlargement and it compresses the passage, so there will be symptoms related to the stream of urine. It means a patient may have to go and wait to pass urine. He is standing there for a few seconds and then he can initiate urination, or he may have to put pressure to pass urine. Or after passing urine, he feels he can't empty its bladder completely. So feeling होती है कि पूरा urine नहीं हुआ, or you take long time to pass urine, or sometimes the stream is broken. You start passing urine, then it breaks, then again you put pressure, and then again start. So these kind of symptoms where there is a blockage goes in favor of enlargement of prostate, although it's not necessarily that a large size prostate will give rise to these symptoms. Even sometime when the neck is very tight, where the prostate is attached to the bladder, that can also cause symptoms. So one group is where there is blockage of urine. Another group is where the enlargement of prostate happens towards the bladder, inside the bladder. Then the symptoms are more like urgency frequency, like the patient has to go more number of times in the night, or daytime the frequency of urination increases, or he gets a sudden urge and then he can't control it. He has to rush to toilet. As we call it urgency. Or sometimes ये desire इतनी strong होती है कि few drops may leak out. That we call as urge incontinence. It means we can't control, the urge is so huge that he leaks a couple of drops or a spoonful of urine. And rarely patient can have sudden blockage of urine when the enlargement is enormous, and sudden stoppage of urine can happen. And these patients can have, in this scenario, some emergency. Otherwise, usually this is a very slow process, and in months and years, they notice the symptoms.
Okay. Now, what all symptoms you have just explained, doctor? Normally, people associate these symptoms with their age. मेरी तो age हो रही है, तो ये तो होगा ही, frequency, urgency. This is the kind of justification we normally give about not going and taking advice from a doctor. कई लोग कहते हैं कि मैं तो डायबिटिक हूं, तो मुझे तो ये सिम्टम्स होंगे ही, मतलब मुझे तो बार बार यूरिनेशन के लिए जाना पड़ता है, ये सिम्टम्स होते हैं. कई बार ऐसा होता है कि हम डॉक्टर को नहीं दिखाते हैं, और द मेल्स वी आर टॉकिंग अबाउट, दे वोंट गो और टॉक टू अ डॉक्टर बिकॉज दे assume that it is a age related or other comorbidity जो भी है उससे related कंडीशन है, और इसका इलाज शायद संभव नहीं है और हमें इसी के साथ रहना है. So this is the notion they normally have in their heads. What would you like to tell them?
Yeah, this is a quite common experience with us also, that many patients feel that there is an aging phenomenon and nothing can be done about this. But they have to understand that these are things which can be corrected so that their quality of life can be improved. Now, as you talked about diabetes also has effect on urinary pattern, but this happens primarily because of effect of diabetes on bladder, urine bladder. Urine bladder stores the urine. We get the sensation that the bladder is full, and then bladder pushes it out. So urine bladder has two functions: storage and throwing it out. So that can get affected to some extent by uncontrolled diabetes or long-standing diabetes in a patient. Primarily, prostate is not affected by diabetes unless their sugar is very much uncontrolled and they get infection in prostate. Then it's a very severe infection because it's a solid organ, and if a organ gets infected in diabetic patient, sometimes it can turn up in what we call in the medical term is abscess. It is like pus pocket inside the prostate. So diabetics, yes, they have to be very careful. If they have symptoms, they should check their sugar. They should be within normal range. And they should not have infection in urine. And obviously, as I said, that is an aging phenomena, but doesn't mean that this cannot be corrected. Like when we see that age causes cataract also, but cataract can be looked after. Similarly, if the aging is causing enlargement of prostate, and if the symptoms start bothering them per se, or they start causing damage to the system, urinary system, then obviously they require treatment. And this can be very well managed now.
Right. We'll talk on that as well, that what all treatment options are available. But before that, I think it's good news for all the men out there. Please notice, if you have these symptoms, then do not hesitate to go and consult a qualified urologist. That's really important. What happens, doctor, many a times, because we live in a society these days where information is in abundance. We have social media, we have, online informations, we have influencers, and these influencers and people have quick fixes for almost everything. They do have quick fixes for all these, symptoms as well. Now, many a times what we tend to do is waste our time on home remedies or these quick fixes, or what the influencer is telling us, ये पी लो, सुबह उठ के ऐसा कर लो तो ठीक हो जाएगा. और ऐसा करते करते जब तक हमारे सिम्टम्स बहुत ज्यादा ट्रबलसम नहीं हो जाते, या बहुत हमें लगता है कि अब तो बिल्कुल कंट्रोल नहीं हो रहा, अब तो डॉक्टर के पास जाना ही पड़ेगा, और कई बार हम बहुत सारा वक्त इन सब में जाया करने के बाद डॉक्टर के पास पहुंचते हैं. तो मैं ये जानना चाह रही हूँ डॉक्टर कि हम सबसे पहले, अगर ये सिम्टम्स हैं, हम देख रहे हैं, तभी डॉक्टर के पास पहुंचे, या बहुत सारे हिट एंड ट्रायल्स करने के बाद डॉक्टर के पास पहुंचे? तो क्या फर्क पड़ता है ट्रीटमेंट में? क्या हमारा ट्रीटमेंट ज्यादा लेंदी हो जाता है, ज्यादा कॉम्प्लिकेटेड हो जाता है? कितना जरूरी है टू गो एंड कंसल्ट अ डॉक्टर एट द फर्स्ट प्लेस?
Grossly, I can divide these patients in two groups. One is they have symptoms. Their symptoms are very slow and they take years or months to develop, and this becomes a part of their life. Like they feel that I used to take 20 seconds to pass urine, now I'm taking 30 seconds to pass urine, now it's almost 1 minute to pass urine. So it's a very slow phenomenon for them. So they feel that it's not causing them trouble. So let me try some usual home remedies and all these things. That's fine. But we have to make sure that it's not causing any internal damage, because slow and unknowingly we should not have something which is harming our bladder or kidney. So that's a prime role of a urologist or the treating physician, to make sure that in this middle-aged man who is having some symptoms, we make sure that there is nothing bad happening inside. And if, as we will discuss about the treatment part, if a patient requires treatment, then many times even the lifestyle modification can help in the symptoms to some extent. And then they may require some drugs and surgical intervention if the severity of disease is more. So we have to make sure that there is no internal damage going to happen in bladder and kidneys. That's the prime importance.
Exactly. And when a patient comes to you, doctor, with these symptoms, what are the things you do to diagnose it, that, what it is, and whether it's BPH or something else?
Yeah. We have to take a careful history about the urinary symptoms of these patients, because as I told that they can have two groups. One is where there is a frequency, urgency, urgent incontinence. These are irritative symptoms. And another group है where there is a blockage. जहाँ urine करने में दिक्कत आ रही है, you can't pass urine and is pushing and out. So we make two groups in our mind that this patient falls in which group, and then we evaluate them. The common tests which are required in these patients are, besides ruling any infection in urine, ruling out any infection in urine, we have to assess the size of prostate. We do by finger examination to see how large is the prostate. Then we get one blood test done, which is called PSA. This is a test which can rule out the probability of malignancy in majority of these patients. And ultrasound to see the size of prostate, the bladder condition, and kidney condition, if it is causing any damage to these organs or not. And to complete the workup, the flow pattern. So we can even quantify what kind of flow he has, and is this flow is reasonable for him, his bladder to be fine. So once we have these 3-4 preliminary tests, we are quite safely placed in the treatment of patient.
Right. And what are the treatment options available, doctor?
Yeah. As I told, that this is a very slow phenomenon in majority of patients. So if they report to us and we assess that their symptoms are mild and they are not bothering them too much, then probably, and if these assessments are within normal range, then probably fluid modification, fluid intake modification can help them. I'll give you an example, like somebody who gets up 4 times in the night, and if he is not bothered about that, he is able to sleep after passing urine, then probably he is okay with that. But if a patient gets up twice in the night and his sleep gets disturbed, then this is a symptom for him. So we have to tackle that part. So first thing is that we have to see that is he drinking milk in the night, or is drinking tea or coffee or liquor in the night. So if he is well hydrated in the night, then he's bound to get nighttime frequency of urination. So we have to manage his fluid balance so that nighttime his fluid has to be curtailed. So nighttime getting up goes down. Then once we assess this prostate, bladder, kidneys, and if we find that there is enlargement of prostate and fluid restriction or modification has not helped, then he will require medication. And medication can help in 2 ways. One is that the flow becomes better, his bladder emptying becomes better. And the other group of medication is there which can decrease the size of prostate. So the long-term benefit can be there, and we can avoid surgery in these patients. And third group is where they may require surgical intervention depending upon the amount of blockage by this prostate gland, the size of prostate. So not all the men who have symptoms for prostate require treatment, but those who require treatment, they can be managed with medication, and a certain percentage definitely will require surgical intervention.
Right. And lifestyle modification is the most important thing.
Absolutely. We have to work on that. And as I told, that diabetics, like a diabetic, if his sugar is not controlled, then he will have nighttime frequency also. So this can be confused with the prostate symptom, where the patient is getting nighttime frequency because of prostate, but it's actually because of uncontrolled sugar. So if he has sugar, then we have to control the diabetes also.
You just mentioned, doctor, that you also monitor the fluid intake. Now, in our society, the phrase goes that drink as much water as you can, drink a lot of water. There's two term called adequate water. We normally emphasize on, having as much water as you can. And people tend to, drink in the morning, like they'll start with 1.5 liters of water. They'll go to bed with at least 1 liter of water, because they are trying various, other practices, therapies as well. Many a times during the day, we don't normally sip water, but we'll keep like 1 or 2 liters in the morning, 1 or 2 liters in the night. And we find that, okay, we are consuming, say, or intaking 4 liters of fluid in a day, which is good. But what is the right way of having water, and what is the right amount of water that we should, water or fluid that we should take, doctor?
Yeah. First, we need to understand why we need water. The purpose of water is that our body is made up of almost 70-80% is water. So we have to replenish that. And there are certain organs which lose water in the form like we lose water in the form of urine, we sweat, we breathe, so the moisture comes out, and even in fecal matter, the stool, the water is lost. So we have to, besides for the consumption or the usage of body itself, we are throwing water in this form also. So if we require, if we are sweating more, then obviously we require more water. If I have like 1.5 liters of liquid and I'm not sweating, I'm in an AC room, then probably my urine output will be around 1 liter. The basic logic is that around 400 to 500 cc of water is required by the body, and around 1 liter is required to clean the blood by the kidneys and throw all the waste product in urine. So on an average, 1.5 liter of liquid is good enough. But if we have like history of stones in a patient or somebody who gets recurrent UTI, then probably we are justified in increasing the liquid to almost 2.5 to 3 liters. Otherwise, on a man who is not doing outdoor activities, probably 1.5 to 2 liters is the limit, which is good enough. Beyond that, whatever we will drink, this will come only in urine. So the myth that if I take 2 liters of water in the morning, my body will be flushed and everything will be fine is a little overkill. I feel that better way to drink water is to space it out throughout the day, rather than drinking 2 liters in a single go and then go on making visit to the loo. Rather, it should be regular so that our body is well hydrated and there is not long period of relative dehydration.
Right. Now, talking about BPH, doctor, many times we have seen that people who are, post 50, they tend to smoke a lot, especially men, or they are drinking a lot of alcohol. And, how good or bad these practices are. Again, intake of caffeine at larger, quantities. Do they trigger or worsen the conditions, or is it okay to have them?
Yeah. As far as smoking is concerned, at the outset, I should say that it's not good at all. In any form, tobacco is a killer. So starting from the oral cavity till the bladder, lung can have problem, the oral cavity can have problem, throat can have problem, even urinary bladder where the waste product of this tobacco goes through the urine can have high incidence of cancer in bladder. So that's as such, smoking is not good. Otherwise, there is no direct relation between the smoking and the prostate. But urinary system is not good for that also. As far as caffeine is concerned or tea is concerned, this has effect on the bladder. It can caffeine can have irritability of bladder. So some patients who have high frequency, they may not be primarily suffering from prostate, but they may be having overactivity of bladder because of these products of caffeine. So when I see a patient and if I take a history that he is a regular coffee drinker or tea drinker, then I have to see how many cups he takes. And many times only reducing the consumption of tea and coffee can reduce their symptoms significantly. So that also helps in managing these patients.
Right. And doctor, we are talking about benign prostate enlargement. We would also like you to throw some light on cancerous enlargement of prostate. How common is that, or how easily it spreads, and what should one do in case of malignant enlargement of prostate?
Malignant enlargement of prostate is also a bothersome problem in a urological practice. We see a lot of patients nowadays coming with the cancer prostate. The reason is that there is more awareness. There are certain tests available. We can diagnose these patients early, and those who undergo regular medical checkup, they can be early picked up. So as far as patient is concerned, in the early phase of cancer prostate, there is no difference in the symptoms, whether it's a benign or is a cancerous prostate. There is no specific symptom for cancer prostate. The symptoms will be more or less same because of enlargement of prostate. The only thing is that the enlargement is because of non-cancerous cells, and another group is enlargement because of cancerous cells. So initially there are no difference, but yes, if it becomes advanced and it spreads to other part of the body, then we'll have other constitutional problems like weight loss, decreased appetite, bony pains, because bones are the favorite site of cancer. Prostate is spreading to that. But in early part, yes, there is no symptom. So any patient who is more than 50 years of age, in our scenario, we do one PSA test. This is a blood test, which is a test done to these patients. Once we explain them that the purpose of this is to detect any cancerous activity in prostate, although it's not a very 100%, but yes, majority of patients can be looked after very well with this. And if the level is within normal limits, then they are in a quite safe zone. So first is this blood test examination. And obviously, as I told, that if a patient comes to me, that I examine his prostate with finger also to feel the hardness, because cancer prostate is usually hard, and non-cancerous or benign enlargement is not hard as a prostate cancer will be. So this is a significant problem in our men population also.
But I think one silver lining is that prostate cancer, unlike other cancer, doesn't spread that quickly, right? It's a slow spreading cancer.
Absolutely, absolutely. This is a very slow growing tumor, and majority of patients, like when I see, they are usually in their 60s or 70s. And if we see that a patient comes to me around 75 years of age, and if disease is very initial phase, then many times they don't even require treatment also. Because if he has lived 75 years of age with the cancer, suppose there is a decade of disease and another decade he will live without any problem with the prostate cancer. But yes, we have to differentiate these patients. One is that somebody who has aggressive cancer, then we have to be a little more aggressive. It's a very slow growing tumor, then probably they can be kept in watchful waiting. But definitely at 50 years of age, we should start screening them, these patients, and try to stratify, and especially those patients who have a family history. Like somebody who had, his brother had cancer prostate, maybe at 70, then we should definitely check his prostate. If his father had cancer prostate or uncle had cancer prostate, then they require more vigilant approach in these patients.
Right. So if it's in the family, then you have to be more cautious about it. Talk to your urologist and keep these screenings, on. And I think it becomes even more important to go and consult a urologist doctor in case you have these symptoms, because just to rule out that it's not cancerous, right? I mean, okay, enlargement of prostate, benign prostate is one thing, but by going and consulting the right person, you are also ruling out that it's not a cancerous, because as you said, the symptoms are more or less the same. So that makes it even more important to go and consult a doctor at the first place.
Absolutely. The reason is that if a patient comes to me with a large prostate, so we have to plan his treatment in either of these two groups, whether he has cancer or he has no cancer. So if there is nothing suggestive of cancer like PSA or the finger examination, then we don't work further. Then we treat him as a benign enlargement of prostate. But if the PSA, which is a blood marker, if it is abnormal or the finger examination is not abnormal, then it indicates that we should evaluate him further, and then maybe MRI or the biopsy may be required in this patient to confirm the presence of or absence of cancer. And then we can categorically put them in either cancerous or non-cancerous group and treat them accordingly.
Fair enough. I'll quickly take some of the questions that have been asked by our viewers. Adi Jad is here. His question is, what is the long-term outlook for BPH management?
Okay. Now, when we talk of BPH management, let's put those patients who have mild symptoms, they can manage with fluid intake management and they are fine, then we can just continue with that. If somebody has enlargement of prostate and is causing him symptoms significant symptoms and he requires treatment, then majority of these patients can be managed with medical treatment in the form of two drugs. One is to increase the flow if there is only blockage in the passage and the flow is poor. The second group is that the enlargement of prostate is quite high and there is an obstruction in flow. So these patients require two kinds of medication. One is to increase the flow and second is to shrink the prostate. The purpose of second medicine is that once the prostate shrinks, the probability of him requiring surgery in future becomes less. And some patients, those who have a very large gland, there is a significant obstruction, or those patients who can't pass urine and there is a sudden blockage of urine. And these are candidates who require surgical intervention. And nowadays, obviously, we have quite safe surgeries in the form of laser prostatectomy. We can do Holmium laser and remove the prostate. It's practically a bloodless procedure. And any size, normal size of prostate is less than 30 grams. But almost 300, 250, 300 gram prostate can also be removed with laser without any blood loss. So these are quite safe surgeries nowadays. But yes, we have to categorize these patients who require surgery and who can be managed with medication.
Right. The most important thing, the bottom line is that you need to go and consult a urologist at the right time. So in case you have these symptoms, please do not hesitate. Go and consult a doctor, a qualified urologist. And again, if you see any member of your family struggling, having these symptoms, please talk to them and take him to the doctor. That's really important. We have Ajit Singh with us, and his question is, are there any specific medications I should avoid due to my BPH diagnosis?
As I told that there are two medications for prostate. If somebody is taking the second kind of medication, which is shrinking the prostate, this can have effect on PSA level. So we have to make sure before we give that medication that your PSA is checked, so that the probability of malignancy is not camouflaged by the medication itself. So that's only for the prostate medication. Otherwise, there is no direct relation with any other medication that can have effect on prostate. Broadly, these two groups of medication are used to patient.
Okay. We have Jay Jadon. His question is, are there any alternative or complementary therapies that might help with BPH symptoms?
As far as symptoms are concerned, as I told that fluid management, then medical management in the form of allopathic drug, which I have been talking about, these two groups. There are certain phytotherapies, means the herbal preparations are also available, although they don't have a very large scale randomized studies, but they have been found to have some effect on prostatic enlargement. And I can't comment on allopathic or Ayurvedic and homeopathic drugs because I don't have an experience of these drugs. But yes, some patients take them.
Right. And doctor, what can a person do to maintain his prostate health?
Okay. As I told that this is an aging phenomena. So we can't hold the age. It has to go on. So what we have to do is, if any point in time we feel that the symptoms are coming, then obviously we need to evaluate the prostate. And not a very strong correlation again, but those patients who have regular sexual activity, they are found to have slow symptom progression in their life. That's one thing which has been correlated significantly. And yes, tea, coffee, and other things which change the bladder activity can improve their symptoms. And otherwise, there is no way we can reduce the growth of prostate, because it's inside the patient's milieu that whether it will grow or not. Nobody can predict that.
That's correct. And Dr. Vijay Kumar, before we sum up the whole session, any take-home message for our viewers?
Yeah, we should take these symptoms of prostate not only as an aging phenomena, but then there are patients who have a significant deterioration in their kidney function or the bladder function because of so benign diseases. So in today's era, we should not lose any kidney or bladder because of prostate, because it can be easily and very well managed, number one. Number two, even if there is no damage to the kidneys or the bladder, still the quality of life can be improved with the right time management and with the right kind of management also. And surgery, as I said, that is not required in most of the patients, but there are certain group of patients who require surgery as their only alternative. One should know what are these kind of patients. Those patients who get recurrent blockage of urine. It means they get retention of urine, they require a tube to be put in, we give medication, we remove the catheter, again after 5 days, 7 days, they get blockage of urine. So we can't keep these patients indefinitely on catheter, number one. Number two, those patients whose bladder or kidneys are getting damaged because of prostate. So these are not the patients where medical treatment should be tried for long or can help them significantly. The third group is where the blockage is there and the bladder starts forming stones in the bladder, urine bladder. The reason is there is a blockage, there is a good amount of urine staying inside all the time, and the stones start forming. And fourth group is recurrent urinary tract infection because of large residual urine, because of, again, stagnation of urine. And some patients can have a significant bleeding coming from the prostate. Although it's not common, but sometimes they can have unexplained bleeding, and then we find that prostate is the culprit, and tackling prostate can help all these kind of patients. So the carry-on message is that is aging phenomena, but your quality of life can improve with the right management. Not all the patients require surgical management, and even if they require, these are quite safe procedures nowadays.
Right. It was wonderful talking to you, Dr. Vijay Kumar. Thank you for your valuable time and this very informative session. Thank you. And we really look forward for many more such sessions in coming times.
Oh, yes. Thank you very much. And I'll be keen to answer all questions in any future forum also.
Thank you so very much, Doctor. And viewers, thank you for your excellent participation in today's session. For more information and updates, stay connected on our FB page, Prostate Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Have a good day ahead. Goodbye.
Thank you. Thank you very much.